shock around lunchtime Tuesday. A gunman opening fire in Jacobi Medical Center in the Bronx just outside of the emergency room. 25-year-old Jacobi Martinez was arrested by authorities before midnight last night, suspected of the shooting. Derek Jackson of Teamsters Local 237 represents hospital police and security workers that work at Jacobi. In fact, he was attending a training session at Jacobi for 28 new officers joining the city's Health and Hospitals Corporation when the training officers sped out of the auditorium.
We got to the emergency room waiting area. We saw a lot of blood. It wasn't chaotic. It was controlled chaos.
He praised the hospital's police officers, who, by the way, are unarmed and without tasers or batons, for quickly getting control of the situation after the gunman fled the scene. He also told me that it was the fourth gun-related incident at the hospital in the last 14 months. He says these officers, who are not part of the NYPD, are also healthcare heroes.
They are unsung heroes, just like the doctors, just like the nurses. They are severely understaffed. Yesterday, Jacobi, which is a large college, a large campus, only had 7 officers on duty. And the minimum should be at least anywhere from 13 to 15, but they only had half.
Jackson says 10 years ago, the union represented 800 to 900 officers at HHC's 11 acute care hospitals and dozens of inpatient facilities and mental health service facilities. Today, he says that number is down to less than 530, with at least 180 officers lost over the last 4 years due to attrition and frustration with low wages in often high-stress situations. To make matters worse, he says the ranks have not been spared from COVID. Many officers knocked out by COVID now, with others working overtime doubles 2 and 3 times a week. But he says their service has been invaluable during the pandemic, especially at its height when people could not get in to see their sick or dying loved ones.
People who are desperate, family members who were trying to get into the hospitals to see their loved ones and they weren't allowed to do it. And these officers had to show compassion, show concern. They're the first line of defense when you come into a hospital. You see them first.